Good afternoon. I'm Pat Living with the Department of Health and Social Services and moderator for the COVID-19 update for Wednesday, September 30th. We are joined today by the Honourable John Streicker, Minister of Community Services, and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Our sign language interpretation is being provided by Mary Thiessen, and André Boursier from French Language Services Directorate will translate questions from any French-speaking journalists. Following our speakers, we will go to the phone lines for questions from reporters and to the reporters in the room. We'll call you by name, and you will each have 2 questions. Before we begin with our speakers, I'd like to verify that everyone can hear us. If any of the reporters are having problems, please email Alexis Miller, M-I-L-L-E-R, at gov.yk.ca. Minister Streicker?
Thanks. Thank you for joining us today on Orange Shirt Day. I'm pleased to be here with Dr. Hanley and Mary Thiessen, Mem André, here on the traditional territories of the Ta'an Quechin Council and the Kwanlin First Nation. We are now entering month 7 of this pandemic. That's a long time, and I know that fatigue can set in. Some folks are getting tired of the measures that are in place to prevent the spread of COVID-19 and are getting tired of hearing about them. This pandemic has impacted all of us, and it has been frustrating to see plans and projects have to be put on hold. We are all anxious to find out when there will be a vaccine or treatment that might allow us to return to more normal routines. I understand this is not easy. Many of us haven't seen our extended families in many months, and connecting virtually and over the phone is no replacement for in-person visits. At the same time, we are watching developments in other provinces where many of us have friends and families, and there is cause for concern. Rising case counts in Ontario and Quebec indicate that the second wave of COVID-19 has arrived in Canada, and it serves as a reminder that we are not through this yet. We must stay watchful going forward to keep our territory safe and healthy. We had another positive case last week. As Dr. Hanley has explained, it's not a Yukoner, so the case does not count towards our total, but it is a case here in the Yukon nonetheless. I look forward to hearing from Dr. Hanley any further news about this case. There is no cause for alarm. We should anticipate some cases over time. So no cause for alarm, but it is a good reminder that by practicing the Safe 6, we keep each other safe. We are well positioned here in the Yukon to handle additional cases when they do arise, as long as we continue to be vigilant and take precautions. Yukoners have done a terrific job of adjusting to the pandemic and practicing the Safe 6. We need to keep this up going forward because it is the best way to keep ourselves, our friends, families, and neighbors safe. We will also continue to require individuals entering the territory from outside of the BC territory bubble to self-isolate for 14 days. Any decision to change this requirement will be based on the recommendations of Dr. Hanley and his team. They continue to monitor developments here in the Yukon and across the country in order to provide our government with advice. The pandemic remains a dynamic situation that is changing week to week and sometimes even day to day. We cannot accurately predict what will happen with the virus a month from now, so it is not possible to have confidence in any long-term predictions about where we will be in a few months' time or into next year. We continue to be watchful, to assess, and to learn how best to protect and support Yukoners. We do know that the Safe 6 will always continue to be important. We also need to continue to check in on our friends and neighbors, provide support, and look after one another, especially as we enter the darker, colder part of the year. Highway traffic has slowed down as we've moved into fall, and soon in the winter months we anticipate it will slow down even more so. We also expect the majority of travelers to the territory to be arriving by air in the coming months. As travel patterns into the territory change, we are also adapting our approach to Yukon's borders. Starting tomorrow, October 1st, we are transitioning to a 9 a.m. to 6 p.m., 7 days a week in-person border presence at our Alaska Highway and Junction 37 borders. Travelers who arrive at our land border outside of these hours and from outside of the BC territory bubble will still be required to sign a declaration and submit their self-isolation plan along with a contact number so our border control team can follow up. There will be signs in place to inform travelers of this requirement and kiosks in place for visitors to put their declarations. These will be similar to self-registration kiosks used at Yukon campgrounds. Let me be clear, it will continue to be the law under the Civil Emergency Measures Act, CEMA, to declare yourself if you are arriving from a jurisdiction outside of BC or NWT or Nunavut, even outside of these daytime hours. Self-isolation is still required if you are arriving from a jurisdiction outside of BC, NWT, or Nunavut, unless you are a critical worker. If you intentionally provide incorrect information or do not stop and declare yourself as required, it is considered an offense under CEMA, and individuals will be charged. Our enforcement teams will continue to greet each plane as they arrive at the Whitehorse Airport. Travelers can continue to expect to be greeted by our enforcement teams, and if you are arriving from a jurisdiction outside of BC, Nunavut, or NWT, you will be required to declare this information and present your 14-day self-isolation plan. Our work with Canada to tighten up compliance for in-transit travelers has come a long way in the past 2 months. So we are also closing down the mandatory information stop near the top of Robert Service Way. Our CEMA investigation unit continues to do great work. Just a reminder that we ask Yukoners to alert us if you have concerns. If you see or hear about behavior that you think may not be in compliance with the Health Protection Order, please call our call center 1-877-374-0425. Yesterday, 2 new charges were laid under CEMA for failure to provide a declaration and failure to self-isolate as required. As of today, we now have laid a total of 17 charges under CEMA. I want to thank the team of enforcement and information officers that have been working hard over the past months to keep Yukoners safe and travelers informed of the rules here in the Yukon and the expectations of those entering and transiting through our territory. As we all know, it was a very wet summer, and officers were out there, rain or shine, doing their part to keep our territory safe. I know they weren't always greeted with kindness and respect, but they have played an important role in our collective effort throughout the pandemic, so I say to them directly, thank you. We have to remember we are all in this together, and we all have a role to play in keeping our territory safe through this uncertain time. Remember to practice the 6 steps to staying safe to prevent the spread of COVID-19. I like to say practice safe 6. This means maintaining a 2-meter physical distance with everyone outside of our bubble, frequently washing our hands, staying home if we feel sick, not gathering in groups of more than 10 in an indoor setting, 50 in an outdoor setting, limiting our travel to rural communities, and being respectful when we do go, self-isolating as required. We also need to be kind, respectful, and patient with one another. These are challenging times, but we can get through them together. I want to thank everyone contributing to Team Yukon. Our public servants, frontline workers, our teachers, our businesses, all of you who have been working tirelessly on so many fronts to keep us safe, informed, and engaged all these many months. The many sacrifices we are all making save lives, so thank you. Merci, Masicho.
Dr. Hanley?
Thank you, and good afternoon and bon après-midi. I just wanted to begin with a quick review of the new case of COVID-19 diagnosed last Friday. And again, this was an individual from outside of Yukon who took ill while visiting our territory, who presented to a hospital and who remains stable and improving in hospital. Although not a Yukon case, this does represent the first hospitalization of a diagnosed individual since COVID-19 was first diagnosed in Yukon on March 22nd. It's a good time to remind people of the work that is undertaken by YCDC or Yukon Communicable Disease Control, and particularly the work that's done before information is made public. Within hours of receiving the positive test result on Friday morning, YCDC had interviewed the individual and their close contacts. After reviewing the information, it was determined the risk of exposure to others was small and no public notifications would be required. At times, of course, we have had to issue notifications when we were not able to identify all individuals who may have been in contact with an infected person. In this case, however, YCDC was able to reach out to all the contacts, and notification was not required. The individual in this case did everything right. They were not ill upon arrival in Yukon, but did present for care once symptoms began. When assessed at the emergency department, all infection control procedures were carried out appropriately. The hospital was fully prepared to care for any individual with COVID, and the hospital staff cared for the individual with the usual calm and high standard of care that the hospital prides itself in. When communicating case information to the public, there are two considerations that we always balance: communication of public risk with protection of confidentiality for the individual that we have both an ethical and a legal obligation to protect. We will not breach an individual's privacy, nor will we speak before we have a good sense of the most relevant information to share. In this case, it was important to wait until the initial contact tracing had been completed so we could provide that assurance around the low risk of exposure to anyone other than this individual's direct contacts. So this person did the responsible thing, and that serves as another reminder to Yukoners who travel to also continue to do the responsible thing. Whether you're traveling to another Yukon community or to a location outside of Yukon, travel should provide a powerful reminder to observe those Safe 6 rules that Minister Streicker just articulated. Whichever community you are traveling to, respecting the norms and wishes of that community, protect yourself from exposure and protect others when you come back. With the recent surges of COVID activity down south, it's even more important than ever to take your travel manners with you. Taking a vacation does not mean taking a vacation from the rules. Travel respectfully, know the rules of the community you're going to, and if you feel sick, self-isolate until you can get tested. When summer arrived, more and more Yukoners traveled to BC and parts beyond. I'd like to think that any one of them would have been able to identify their contacts had they been sick and hospitalized while elsewhere, and that they would have been treated with care and compassion. And please remember to treat our visitors with respect and compassion as well, whether healthy or ill, whether here to work or here to visit. Remember that travel manners go both ways. As the days cool down and darken, so will we be returning more to the indoors. We know that weather, holidays, and other activities traditionally bring people indoors more often, and looking ahead, we need to think about how we're going to do things differently within our new normal as it moves indoors. Thanksgiving has been on the minds of many. Some people have small, others larger families, and many of us have traditions built up over the years. Thanksgiving should essentially be treated as any other gathering, with no more than 10 gathered at a time, and these people should be either in your bubble or spaced appropriately. Some people are planning outdoor gatherings to accommodate larger family groups, or even serving dinner in shifts. And these are some of the actions that you can take to reduce the risk of yourselves and your household and your guests while still enjoying all the feastings and the festivities. Everyone, particularly Tim, is waiting for guidance on Halloween. I'm happy to offer some guidance on just how to do that. With proper precautions, it's okay for children to go trick-or-treating. They should wear a non-medical mask or face covering when appropriate, or consider using a Halloween-themed cloth mask. They should trick-or-treat with those within their consistent in-person social bubble and not gather on or crowd doorsteps. A witch's broom or a sword would be good to knock on doors with. If you are distributing candy to trick-or-treaters, consider how you can do it safely. Maybe use tools to distribute candy at a distance, like a hockey stick or tongs. Have only one person responsible for handing out the candy, or sit outside to distribute only wrapped or store-bought treats. And please don't leave treats out in a communal bucket. Even though many children will be wearing mitts or gloves, I expect, this is not a practice we should sanction. So that's a lot, of course, just from my words, but the guidance will be posted on yukon.ca by the end of this week. If trick-or-treating is just not something you're going to be comfortable with, we'll also have suggestions on other ways to make Halloween fun for kids. Children have lost so much already as a result of COVID, but with some careful guidance, we can make Halloween still happen in Yukon. On the subject of guidance, we'll shortly also be able to post our guidance on singing and playing wind instruments. Before finalizing, we took some time to consult with All City Band and other musical organizations to be sure the guidance was practical enough for rehearsal settings. I'll go over some of the principles. Some of what singing and music, particularly wind music, will look like this year, keeping a minimum of 2 meters between singers and musicians at all times, facing forward while singing or playing the instrument, so not in a circle or facing each other. Conductors should maintain either 4 meters from the choir or orchestra or a face shield and then 2 meters distance. And performers should maintain 4 meters from the audience or be separated by a barrier, such as a plexiglass barrier. Keeping rehearsals short is also another risk mitigation, and ensuring good ventilation when practicing. Of course, regular cleaning of instruments and mouthpieces and all that will also be part of the guidelines. And the other guidance that we're just finalizing is the much anticipated return to work or activity after illness. And that, of course, is really very similar to the school guidance, the traffic light guidance. We're just putting some final tweaks on that, and we should also have that finalized and posted before the end of this week. Again, I do keep getting asked about bubbles, and that's a good thing, because I think the more we talk about it, the more we're clear on what our obligations are in regards to social bubbles and other interactions. But the overall wording I like to use is keep our social groups small and intimate. We do suggest that people can enlarge bubbles, of course, up to 10 to 15 people. That was I think in June when we first came out with that guidance. The 15 being on the higher side, but recognizing that some families are larger. The language directly from the website says some of this, and I think it's worthwhile going back over that. Your social bubble starts with people you live with and who regularly come into your household. And then slowly add members to your bubble that make the most sense for you and your household. For example, people you may want to spend more time with, or another household with similarly aged children. Everyone in a household must be part of the same social bubble. And building a social bubble does not mean of course, that the threat of COVID-19 is not here. There's always that chance if we see an increase in the number of cases that we may have to put restrictions back in place. So when you're having Thanksgiving dinner, keep this in mind. The ideal social gathering is actually held outside unless everyone inside is within your bubble. Otherwise, any indoor gathering should be limited to a maximum of 10. And the more groups that you're involved with, the smaller you should keep your social circles. There's no hard math here. This is guidance that should help you be aware of your contacts and keep them small. If your social bubble, for example, is 15 people, be extra careful when you're in a sports mini-league. The preferred arrangement would be a smaller household bubble so that your overall contacts are again kept to a reasonable and small number. Again, keep your bubbles safe and keep them consistent. As we spend more time indoors, we have to be more vigilant about spacing from people not in our bubble. And then let's enjoy and continue to enjoy outside life as much as we can. We have school groups, children in a classroom together, not socializing with others in the school, but who will likely have a separate bubble outside of school. So there could be some overlap there. And then there are the sport bubbles as well, as I said, being the mini-league opportunity. So remember, though, that there are rules around mini-leagues, and although they allow for closer interaction than that 2-meter spacing, they are not the same as social bubbles. And again, pulled off the website a few of those requirements. Do not participate, of course, if you're required to self-isolate. Only play in a maximum of 2 mini-leagues. Organizers should keep a list of contacts within that, of the participants within a mini-league. And when not actually playing, you need to practice the physical distancing and the other public measures whenever possible. So really you're only allowing those limited interactions that are part of playing a game in order to support the playing of the game and allowing those closer interactions. But otherwise, you're spaced apart. And of course, perhaps most importantly, do not play if you're sick, no matter how mild the symptoms are. We're again fortunate as we look around the country how we have not had to roll back or restrict our public measures. If sustained COVID activity does arrive in Yukon, you can be sure that our bubble and gathering sizes will have to get smaller. We are in a good place right now, and we'd all love to stay here. I think that's all for today. Thank you. Merci. Merci. Merci Cho. Ganoshish.
Thank you. We'll go now to the phone lines, and we'll begin with Marine Laurent-Boréal.
Oui, merci. C'est une question pour le docteur Hanley. J'ai entendu que certaines écoles ont interdit aux élèves de chanter en classe. Est-ce qu'avec les nouvelles mesures en matière de musique et de pratique musicale, est-ce que vous allez encourager les écoles à changer ce règlement?
So the question is for Dr. Hanley. Some schools have prevented kids from singing out loud in classrooms, and I'm wondering if the new guidelines you're going to issue are going to permit kids to start singing again in their classrooms.
Oui, j'espère. Et c'est pour ça qu'on a attendu le développement de ces guides pour permettre dans toutes sortes de situations la capacité de chanter. On respecte des règles.
Could we have that in English, please?
Sure. Yes, the guidance is intended for use within schools as well, the musical guidance. So we would expect that schools can now adapt following the guidance to be able to allow for music and band within school settings, again, as long as the rules are followed. So, as with any of these one-off guidances, it will then eventually be incorporated into overall school guidance. So we have to, I think, allow ourselves that there are these separate pieces that are almost updates. But yes, this guidance will be able to be applied to community as well as school settings.
Thank you. Avez-vous une autre question, Nadine?
Non, merci beaucoup.
Merci. We'll move now to Haley from Yukon News.
Thanks. I guess my first question was about the enforcing the declaration without having people at the info stop. Are you sort of relying on community complaints, or how do you figure out that someone hasn't declared their entry into the territory?
Thanks, Haley. I think it'll be a few ways. First of all, the info stop that's at the top of Robert Service Way was really for those travelers that are in transit. And we've been doing all sorts of work with the Canadian Border Services Agency to tighten that up. We get, they've restricted the number of entry points. They've got a checkout system. They share that information back with us. We have found that is working much better than it was, say, several months ago before those upgrades to CBSA came into place. With respect to other travelers, what we note is that travel is dwindling at both Watson Lake and Stuart Cassiar, and we know that the travelers tend to come across during those hours, sort of the mid-morning and the late afternoon, so we think we're going to capture most of those travelers. And I think then we use this system afterwards where they still are required to sign a declaration. If someone sees people like they do now, they report, we follow up. But we could also put in place a check stop now and then to see if people are doing it, and those kinds of check stops create sort of a message back to travelers that we're serious about this and that they know we're going to follow up. So I think we'll use a variety of techniques, although we think that the number of travelers that will be passing through while it is staffed will be the preponderance of the travelers.
Thank you. Haley, do you have another question?
Right, yeah, my other question, I know, as usual, limited information is given out about people that test positive, but I was wondering, in this case, if it was a person outside the territory, were they self-isolating when they received their diagnosis?
I will say that the person was following the direction they needed to follow. And that's about all I can say. I'm sorry.
Thank you. We'll move to Philippe, CBC. Philippe, are you with us? Perhaps we'll move on, and if Philippe joins us, we'll go back. We'll move down to Gabrielle, Whitehorse Star.
Hi, sorry, I think I heard Philippe come onto the line. If you wanted to ask a question, you could go ahead.
Okay. Moving on then to Laura at CBC. Maybe CBC's having an issue. Nothing?
Oh, sorry, Philippe is there. He could.
Sorry?
Yes, I am.
Oh, Philippe, okay. Please go ahead, Philippe.
Thank you. It's a question for Dr. Hanley. We mentioned if things get worse in BC or elsewhere, more restrictions could follow in Yukon. Do you have a set benchmark that you're looking at? Is there a trigger or a certain number that would cause those conditions? Or is there a standard you could point to of when would that happen?
Yeah, so again, I'll refer you to the criteria that were outlined in the path forward. So that gives the categories of criteria, and that includes, of course, the travel importation risk. In other words, what's the chance of someone infected with COVID actually coming across? But then there are these 5 other criteria that involve ongoing community engagement, public health capacity, healthcare capacity, and adherence to public health measures. They're not all things that we can measure precisely, but each of those categories gives us an idea and a comfort level of how well we're doing. And probably the single most, I was talking about this with the minister earlier, I think probably the single most important piece of data might be we're doing this really well. So we've done this really well through a time when BC cases were very low, but even through a time when BC cases have risen substantially. So we know, and we predicted, I actually expected to see more cases associated with the opening of the relaxation of the self quarantine. And really, in that whole time, I think we've had 2 active cases in Yukon, one of whom is a non-resident case. So clearly, the whole concept has worked well because people are doing the right thing, and people are by and large observing those measures. And again, just to reiterate that these are government decisions based on public health assessment that comes from my advice, based on the looking and the analysis that we do on the team that I have.
Do you have a follow-up, Philippe?
I do not. Thank you.
Thank you. Laura, are you with us?
I am. Hi.
Please go ahead.
I have a question for Dr. Hanley. After releasing these new guidelines last week for when students and staff should stay home when they're sick, have you noticed a decrease in the number of students and staff who are absent from school, or a decrease in the number of people and students getting tested for COVID?
Yeah, it's a really good question. I don't have the data on the impact yet. Of course, I'm very interested in that. I think it may be too early to get too much of a sense, just as because people are getting used to it. But it's definitely something that we will be following up. In terms of testing numbers of kids, I would say I can't say enough to know that we've had a change, because the numbers do fluctuate from day to day and week to week, and of course that depends on so many things, including accessibility of testing, the hours at the testing and assessment center, and of course the prevalence of illness. So these are definitely measures that we will be following and also making available. And clearly, we are interested in learning the impact and hopefully the reduced burden and of unnecessary stays at home for otherwise transient mild illness.
Thank you. Next question, Laura?
Thank you, Dr. Hanley. Another question. Last week you mentioned that, as schools are reopening, you're still working out some kinks. Could you elaborate on what some of those kinks are and any other changes that have been made in schools to respond?
Well, yeah, I think I could probably say a few things. I think it's really just getting used to the guidance and the operational plans for each school. How does the classroom spacing work? How do the flow of children work? So this is really based on just things that I've heard without really giving specific examples. But there are, I think it's just kind of learning, that whole kind of adaptation to new ways of behaving, whether it's playing on the playground or filing in and out of school or getting onto a bus. So I think it's just kind of those growing pains. Of course, illness, dealing with illness was something that we really wanted to respond to as early as possible and develop that guidance. So I think that is hopefully a kind of a game changer in making things more pragmatic. We also have had a call with the principals last week with myself and the YCDC team to really go through, how's it going so far, and answer a lot of the questions, whether they were questions about spacing or questions about what happens if what if there's a case, questions about the traffic lights and the age distinctions between the two different traffic light guidances. So I think there clearly is just a really kind of getting comfortable, but really sensing that by and large things are going very well, and kids and staff are settling in well.
Thank you. We'll go at Gabrielle, Whitehorse Star.
I have no questions. Thank you.
Thank you. We'll move then to Claudienne, Radio-Canada.
Pour le docteur Hanley, parce que c'était très attendu, pouvez-vous me donner donc les directives en français, vos recommandations pour les célébrations de l'Halloween?
Well, the question is for Dr. Hanley. Can you please repeat in French your guidelines for Halloween and the celebrations around it?
Oui, je peux offrir plus ou moins un résumé de guide et ça sera sur le site web à la fin de semaine en français aussi. Est-ce que ça sera traduit en français par...
J'espère, oui.
On espère. C'est que, en général, c'est bon pour célébrer la fête Halloween. Donc, peut-être ça, c'est le plus important. Et donc, on a les guides pour considérer d'un masque de tissu, surtout quand la distance peut être plus proche que les 2 mètres, et pour éviter d'avoir trop de personnes à la porte en même temps, il y a pour distribution de bonbons, peut-être utiliser des outils pour avoir une personne seulement pour donner les bonbons, pour pas avoir les bonbons tous ramassés, ou de les avoir envoyés individuellement. Et donc c'est vraiment juste les choses pratiques pour suivre les mesures, mais pour permettre les enfants de célébrer. Et pour ceux qui sont pas très confortables avec toutes ces mesures, on va offrir des autres suggestions pour célébrer Halloween quand même.
Prochaine question, Claudienne.
Oui, merci. Juste pour votre information, c'est juste pour les fins de la radio que j'ai besoin de répéter en français. C'est juste pour ça, pas pour vous embêter. Mr. Streicker, so it is fair to say then that the level of scrutiny, of surveillance will be going down at the borders, correct, at the land borders? And is there a saving of costs involved with that?
Well, I think, Claudia, thank you for the question. I think, first of all, I'm not sure I would say that there will be less scrutiny, because in some ways we've been increasing our SEMA enforcement officers over the past month, and so maybe there's a bit of an offset there. And I think that also the number of travelers is down. Will be increasing. We think that there'll be an increase at the airport, so we will increase the work at the airports. Definitely, we're trying to adjust to the reality of travelers and respond while maintaining the level of safety that we've had so far. I think we, at all times, we adjust, we assess, we respond. So I again just would like to say thank you to all those folks who have worked either in enforcement or information at all of our border points, and they've done a great job. I think that we will make sure that we are attaining a level of safety at all times, and we will respond as necessary. We think that this is the right level for the travel that we are facing.
Thank you. We'll move now to Tim from CKRW.
Good afternoon, Dr. Hanley, and thank you for clarifying the Halloween standards for us. You made a lot of kids happy, so thank you for that. I appreciate that you can't divulge too much information about this latest case, but with some of the other cases online, there's been a lot of the public are wondering or assuming is from BC, or it's from outside or not from BC or from elsewhere. How come you don't feel that you need to divulge where this person is from primarily to kind of quell the public speculation?
Yeah, it's a good question, and I think we have to go back to our basic principles and of communicating when we need to communicate public risk, and really that being the core purpose of doing a communication, as well as much transparency as we can afford. So, for instance, we felt that we had an obligation to report the first hospitalized case. Now, of course, we don't report, say, cases of people hospitalized with influenza, except in summary, as a kind of a periodic summary of our surveillance data. So but we don't kind of announce individual hospitalizations with other communicable diseases or any other disease for that matter. So it's really, but noting that this is a significant event for Yukon, we felt that it was important to publicize that, but with respecting the confidentiality around any other details. And I think the same applies to jurisdiction, of origin. I feel that we that is not really within our right to divulge where a person comes, because it leads to the further potential for identifying individuals. We have to be so, I think, extra careful in a small jurisdiction about what we say and what we don't say, and any amount of information can quickly add up to the potential for identifiability. So I think what tells us more, so again, if we talk about how well is our BC bubble working, for instance, what's the problem we're trying to address? And the issue might be, is our BC bubble working well for us? Is that opening up of Yukon society, giving us benefits? And are we able to tolerate that risk? And that's the larger question. And I think that does not depend on whether an individual comes from BC or not. I think it depends on how are we doing so far. So what are the case totals that we've seen in the whole time that we've had the BC bubble open, and that's where I go back to those those tiny numbers of what we've actually witnessed. So I think that there may be a sense that we're withholding information. I like to think of it as that we're doing our best to protect individuals, protect families, protect communities, and we've always made that commitment. But at the same time, to communicate as best as we can the risks to the public.
Yes, please go ahead.
Just to try and follow on Tim's question, I've just finished doing a round of community tours, or sometimes they're virtual tours, depending on what the community wishes are. And many of those visits I did with the Premier. There's another side to this whole notion, to your question, Tim, about sharing information. We've spoken with community individuals who have expressed to us their nervousness to go get tested when they feel sick. And the reason is that there's a real stigma attached with even being tested and how a community perceives that. This is why it's so important that, number one, we be kind and gentle with each other and try to be respectful around the realities, but it also speaks to what Dr. Hanley is talking about, that information should only be shared at the level at which it is better for the community as a whole. We worry, or that gives us a worry that if we're so open with information, sometimes it can lead to people being fearful about even disclosing, and we don't want anyone to be afraid to go get tested. So there is I think it's natural that everyone wants to understand these pieces of information. The challenge is that we need to make sure that we're doing it in a way that is protecting the overall health and well-being of the community.
Thank you, Minister Streicker. Tim, do you have a follow-up?
And just wanted to ask you about, you talked about contact tracing with this case, and actually was having a bit of a discussion on Twitter with someone last week about it. Can you go through the parameters of what you do for contact tracing? And I know I have the app on my phone, the national app. Are you feeding information to that app? Kind of can you take us through all that process?
Am I on? Yeah. Thanks. I can try to do that as best as I can, and really the real experts of that, of course, are the community nurses and YCDC nurses that do this every day, and it literally is their bread and butter. So, but really, it's a risk assessment process. It's actually interviewing the individual who is sick with whatever disease it is, whether this is a sexually transmitted infection, or whether it's tuberculosis or any other communicable disease with outbreak potential that we trace. And COVID, of course, is the newest entry into that category. So it's who were you? Tell us about your last few days. We go back to 2 days before symptom onset, so to give that kind of buffer of the potential for transmission during that pre-symptomatic time. So we go back 48 hours and then go over where were you, who were you with? Of course, the family are usually, if there is a family, they're usually the immediate contacts. And then it's assessing, well, what was that contact like? So are these household contacts where you're sharing food, you're sharing space, or was this a work contact? If it's a work contact, were workplace rules in place? Was there a natural contact, or was it a workplace that has everything set up, COVID protocols in place, so that in fact there was no significant contact? We go over places. Where has the person been? Were they around town? Were they in certain settings? Of course, you've seen with the notifications that we look the previous public notifications. Was there a certain church or certain shop or store where there was a potential where, say, I was in such and such a store for 45 minutes, and there were, perhaps numerous interactions within that, then that might be something that we say, well, that's a higher risk interaction versus stopping at a gas station for 5 minutes and with no significant interaction with people. So all of those contacts, whether they're close household, family, friend, those layers of contacts are part of the assessment for risks. Sometimes that can be handled in a few minutes in one interview. Sometimes it takes going back and asking someone else. It might be asking the spouse or the partner, or the parents, or the sons, or the daughters. So it really sometimes requires actually several interviews to get all of the information, or to go back. So it can be a process that takes hours to days to actually complete. And then of course there's the symptoms. So what are there symptoms or not associated with the contacts? And so testing contacts with symptoms is part of that process. And of course, then having them self-isolate until we get the test results if they are symptomatic. So it's going through all of that and then really packaging that into a story. What's the story? Is there, what do we need, if we need to notify, what do we need to do? Regarding the app, that's, it is still not easy for us to determine the place of the app in our practice. We're certainly watching with interest how other jurisdictions are picking this up, how it's being used in Ontario and Newfoundland, for instance, and really watching to see. It's not clear what additional role an app will play in a small jurisdiction like ours, because we tend to have good capacity to contact trace. We have, I would say, we have substantial expertise in contact tracing, and we know people. We know where to find people in a small jurisdiction. So it tends to go more quickly and smoother in a smaller jurisdiction. So the additional place of an app, where really an app will, if the intent of the app is followed, so a person has the app and is diagnosed positive for COVID, and then chooses to upload that information to people, to contacts, then it's a kind of of course, contacts identified through cell phone interaction. But it's difficult to tell through those what is the significance of those contacts. And so does it add useful information or not? I think it's still the big question that we haven't answered. We're looking forward to really the experience of other jurisdictions to be able to inform our approach to it here.
I'd like to thank everyone for their time today. Beginning on Wednesday, October 7th, our COVID-19 updates will take place at 11 a.m. so as not to conflict with the sitting of the Yukon Legislature. That's Wednesday, October 7th at 11 a.m.